Well, I mean, I think medicine in general has evolved over time, and the one size fits all approach is that evidence based approach to affect the population in general, and there's been tremendous benefits to that over time. I think we've advanced to the point now where we realize that no two people are the same. There's been a lot of research done in terms of not just only specific gene testing, but also in ethnicities, and realizing that certain medications may be more effective in certain populations than in others. So I think personalized medicine is really the next step of healthcare. And we've scientifically gotten to a point where it actually makes sense to do that and for it to be cost effective. The one size fits all, of course, is that initial step. But if we want to get to the next step of quality of care, then personalized medicine, making sure that what we're doing is the most effective treatment for that individual at that time, which is really what makes sense. It's kind of like an artist painting a picture, recognizing that the brush strokes for this certain sort of material need to be different in order to get a certain effect. So I would say personalized medicine is really the next step of medicine to more effectively treat the individuals. Population health still is a major focus of healthcare because there are populations of people that are still not having good outcomes in terms of disease processes. But in order to get to a level where where we're at an advanced stage of healthcare, it needs to be a more tailored approach to the individual. Well, I would say, everyone's biggest concern and question is, am I at risk for this certain type of cancer? And I think personalized medicine, maybe not exactly today, but I think it will get to the point where it can answer that question for a large percentage of our population of people. I was just watching earlier today before I came downstairs. Dr. Oz had a topic of discussion. Should everyone be on aspirin? Because there was a study that said that daily aspirin use, I think it was either for 5 or for 10 years, decreases someone's risk of colon cancer by 25%. And then, although it sounds great on the surface, there was a gastroenterologist saying that it does predispose people to ulcers and for other GI concerns and issues. So that's an area, that could be looked at as, we need to personalize that approach to the individual that we're treating. So I think that the personalized approach to medicine and to healthcare is something that is in development. Great strides have been made, but there's still a lot more work to do to both show the effectiveness at the screening level as well as at the treatment level. Well, I think one of the previous questions kind of summed it up. The one size fits all sort of approach is quickly becoming an antiquated model of thinking. So without the personalized approach, I think the outcomes, particularly in breast cancer research, we see that very prominently. Without a personalized approach there, we would be decades behind in terms of treatment. Again, the screening portion of that in terms of prophylactic surgeries is difficult to assess over such a short period of time. I think we need more time in order to really assess the effectiveness of that. But if we can get to a point where the incidence of breast cancer is significantly reduced, or the incidence of treatment of breast cancer is significantly reduced because of personalized medicine and testing, I think over time we'll be able to see the true effect of what it's done in our healthcare landscape.